Hey everyone, this is Amory at ETS Vision. In our last video, we talked about getting a face-to-face interview. So now that you have that planned, I'm going to go over a couple tips on how to prepare for the interview. Tip number 5, prepare your references and research the practice. First and foremost, contact your references, let them know that they might receive a call or even an email from the practice. Most practices will do a reference check immediately following the face-to-face interview. Your references should be people who genuinely want to see you succeed in your career and just do well. It can be a former coworker, a current employee, possibly a past or present residency or fellowship director. They should be able to just answer questions about you on the fly and also have seen you in both a clinical setting and in the OR. You know, how do you interact with patients versus how are you surgically? They should also be able to describe your strengths and weaknesses in detail and in a professional manner. Also, research the practice before you show up for the interview. Look at the owner's website, look up the doctors, the staff, the other associates that are in the practice. What procedures do they perform? What experience do they have? How do they market themselves to those around them? This will let you know a lot about the practice before you actually show up for the interview. Okay, now that you have your references prepared and you have done your research on the practice, tip number 6 is to prepare a list of questions for the practice. You are trying to make a long-term decision and find a position where you will spend many years. So it's just as important for you to interview the practice as it is for them to interview you. So it's important to have a list of questions prepared that not only shows that you are genuinely interested in the practice, but it also will help you to make an informed decision when that time comes. It also can take some pressure off the interviewer, which can definitely play in your favor in the long run. So I'm going to go over 12 questions that you can use when interviewing with your prospective employer. Number 1, what are your treatment or practice philosophies? Are you a conservative surgeon? Are you an aggressive surgeon? Number 2, what would be expected of me as an employee and what role would I be expected to fill? For example, if you're a glaucoma specialist, will you only be seeing patients who have a history of glaucoma, or will you also be doing a fair amount of comprehensive, just general cataract surgeries? Number 3, tell me about your patient base. Are they families, geriatric, pediatric, etc.? Number 4, what demographic changes have occurred with your practice in the last 10 years? What changes are on the horizon? Number 5, do you actively market or are you a referral-based practice? Number 6, what kind of equipment do you use? Number 7, what about your practice are you the most proud of? Number 8, where do you see the practice in 5 or 10 years? Number 9, what are your professional goals? Number 10, what are your goals for the practice? Number 11, are you referring out any cases? And finally, number 12, what do you expect of the new associate to bring to the practice? Hopefully these questions will allow you to make the right decision and you will end up in a practice where you can spend the rest of your career.